and I am real excited to about this topic today. I've been looking forward this for quite some time. We've got Carl Hirschman, who's the founder and CEO of CareTree, and by glancing into chat, I actually can see that we've got Bob Pierce from the Option Group and Denise Valeria from the Option Group, who are the first time that I came in contact with CareTree is that because they're aging life care managers that use this platform in their practice. And that was my first exposure to CareTree. And then somehow Carl and I's paths crossed, and I discovered that this platform is not only useful for aging life care managers, but the general public can log in and utilize this technology to help their families, their loved ones, coordinate care. So Carl, I'm really charged up to have you. And oh, we got Carl's colleague, Sienna, correct? Great. So I'm psyched that we've got both of you on this discussion today. But Carl and Sienna, before we dive into what CareTree is and how it helps families and professionals, let's get to know the two of you a little bit better. So tell us a little bit about your background and what led you to founding this company.
Yeah, thanks, Steve. And I saw Denise pop up in the chat as well. I love Denise. She's been a longtime customer of CareTree and one of my favorite care managers out there across the country. So I actually founded CareTree almost 10 years ago now. It started in 2012 when my mom, who is she's the ombudsman for the state of Iowa. She's actually getting ready to retire this month after many years of service. But she's been a guardian and conservator for a family friend. She's watched out for a number of other family friends, relatives, loved ones as they've moved through that aging process. And I had another company that was in the senior living industry, and she came to me and she said, "Hey, I'm having this problem where I'm carrying around this growing binder full of medical records. I'm playing phone tag with the professional caregivers. And then I'm having to relay all of this information out to the rest of the family, spread across the country." And so I talked to everybody I knew in the senior care industry, and we couldn't find a solution. So if you put a big problem in front of an entrepreneur, you get a new company. And so we started CareTree in 2012, and it kind of we're working on it. And then we were one of 10 companies selected for AARP's Innovation at 50 Plus. So we knew we were solving a real problem and kind of went after it full time from then.
Wow, congrats. That says a lot, because I know that when AARP does these sort of, I don't want to call them contests, but sort of when they put out a call for something, the amount of respondents that they get is mind-blowing, and their selection process is definitely really extensive. So to be recognized by them for that is fantastic. So okay, well, we're going to dive into what CareTree is and how it works in a moment, but I want to get to know Sienna a little bit better. Sienna, what's your role there at CareTree? And then tell us a little bit about your background.
Hello, so I'm the sales and marketing assistant here at CareTree, and I recently just graduated from my master's. So I joined CareTree just to get to know more about the healthcare and technology sector.
We love it, and we love bringing young people into this field. So, Carl, great job in bringing on Sienna, and delighted to have both of you on here today. So let's dive in and sort of share with me, like, what can one expect with CareTree? How does it work? And, you know, I think I like I said earlier, I know that you help aging life care managers like the option group. But I'm really intrigued at the fact that a family can jump on your platform and receive services. And so maybe we could start with that, and then we can kind of morph into how you work with providers.
Yeah. Yep. So we originally started to solve that family problem that I mentioned, and have always been kind of mission oriented on how can we help people that are in a caregiving situation, family or professional, and regardless of somebody's income or socioeconomic status, we want to make caregiving easier for everybody and create a solution that is at the basis free for a family to use, and eliminate that barrier to entry, and then figure out ways to continue to provide value to them. So that, to your point, most people know us on the professional side, aging life care managers, guardians, patient advocates. But we have thousands of thousands of families that sign up for CareTree directly. They download our app on the App Store or through Google Play, and they create that profile for themselves, or for a family member, or for an aging loved one to be able to manage all of that information. And we just continue to add value there. And yeah, that's free for families to use. In fact, I had a call yesterday from a gentleman who was who discovered us and was creating a profile for his dad, and his response was, "Where have you been all of my life?" The thing that we hear from families most is, "I wish I had known about you sooner."
That's great. And so now that's why you got somebody like Sienna to help you get the word out. And hopefully we can help you get the word out here today with this discussion. So I'm curious, do you have the ability to sort of dive in and kind of give us a demo, or kind of share how this would work?
Yep, I do. I see that even in the chat, Eileen there requested that we show off and show what it looks like. So I'm just gonna log in. I've got a family test account, and so this is a little bit different than our professional functionality, but fundamentally the same as well. If I can remember the password on that. So what we did was we wanted it to be extremely easy and intuitive to use. So instead of trying to reinvent the wheel and teach people how to use something completely new, we take a lot of our design cues from things that people are used to using, whether it's Facebook or Google or Microsoft. And you'll see when you first log in, you have an activity feed. That activity feed, kind of like the wall as it relates to Facebook, gives you a running history of anything happening to any of the patients that you're connected to. In this example, I've actually got my twins. I've got my own patient profile, and I've got a couple of test profiles, so I can see what's happening in that data. And then I've got my own task list and my own calendar. But the big thing is going into a patient profile. It gives me quick access to the most pertinent non-medical information, as well as the most pertinent medical information. And it's all built on Hipaa compliant, role-based security. So users get to choose who gets to see what, and control that on a per patient basis. And then down below, we have the kind of the primary activity tabs, where people can store information, and I can go into that, and they're kind of self-explanatory from the titles. But there's some features of that we purposely built just from our own experiences. And then in the show full profile, this is where all of that demographic data goes. And we've done some really cool things here on the family side. So you can put in your general information, your medical information, but you can also do handy things like put in your insurance cards. So as the Medicare or Medicaid plan updates, or like, again, my kids, or my insurance, it updates each year. I get a new card, so then I can just stick it in here and I've got it. I can even take a picture of the card, and then I can archive my old insurance. So if for some reason I need to access that, I can do it. We have those important legal documents where I hear a lot of families, they have a folder somewhere in the home of just in case, but if nobody knows that it exists, it doesn't do you any good. So we have a place for the advanced directives, power of attorneys. You can indicate the responsible parties, as well as those end of life documents and information. Financial. This is a piece that we added for families recently, where again, kind of in preparing as COVID hit a year and a half ago, we started rethinking and prioritizing features about like what happens if you or I go on a ventilator. Everything had been prepare for mom or dad. We don't really need to worry about it, but suddenly any of us could have been impacted, and we need to start thinking about the information to document. So you can document those financial resources, such as my different 401ks and bank accounts. So if something were to happen to me, my family knows where all of that is. We even have the guardianship information for either family guardians or professionals. And then the other thing that we added for COVID was our emergency access function, which is pretty cool. So if you turn this on, what it does is it creates a unique emergency access link. And what that emergency access link does is, let's say I put this on the lock screen of my iPhone, or I can put it on a medical alert bracelet, or for a senior, we might do a QR code and stick it on the refrigerator, so that if first responders ever come in, or if I'm riding my bike on the weekend and get hit by a bus, first responders could access this. It would give them access to all of the most updated information. So then they would have things like my advanced directive, if I put that in there. And then that would also text message the people that I have connected to my profile. So in a professional setting, that might be the care manager. In my personal setting, that may be my sister, who's a doctor in Philadelphia. So they can be alerted with me being unconscious and hit by a bus, or if you have a senior, maybe they're a wanderer, and then everybody gets notified. They can find out who made that notification and reach out and find out what's going on. The other thing that we added is our trusted access function. So again, it's important for all of us to have these things documented. But my will, for example, I may not just want to give out so that everybody has access to it, or how to access my cell phone, or how to access my home, or let's say I have pets that need to be taken care of. So the hit by a bus situation, get put on a ventilator, whatever it may be, I can grant trusted access to any number of individuals. So again, like I've granted it to my sister, to one of our attorneys. So if I'm not able to respond, they can trigger it, and it creates a waiting period. And as soon as that waiting period expires, if nobody has declined the access, then they would get full admin access to my account. So if I'm unavailable, now they can take over, get the information, and it's not that envelope that's hidden somewhere in the home. It's something that they can access and get everything and have everything that's updated as well.
Wow, that's really robust. And so just now, just to reiterate, so this is like your typical client, that this is the public that kind of comes here, like you talked about, is that I'm in this caregiving situation. Somebody refers me to CareTree, or maybe I stumble onto you in the online, and then I can just go to caretree.me, sign up a free account, and I'm going to get a dashboard like this that I can start building out. Do you have, like, how long does this typically take, and what are the steps that you sort of see that your client base takes on this? Is it something that they generally jump into and do overnight, or is it spread out over the course of many weeks or many months?
Yeah, great question. That was actually something that we discovered early on, was that people would, they would know they had this problem. They would go and create a profile, and then it was, oh no, I don't know where to start. There's all of this stuff that I probably should be documenting. There's all these different things, but I don't know what's important, what I need to be documenting right now. So we did a couple of different things to solve that. The one that we did a long time ago was we built an assessment. So if you go to our homepage, there's Start Assessment, and this walks a family member through some of the things that they should be thinking about, and some of the things that they should be documenting. And then it automatically, at the end, they can create a profile, and it's going to give them a task list of things that they should be doing. And then we actually built this. We found a lot of senior care agencies of different types, senior living, home care, care managers. They loved this. And so we built a version that they can actually put on their own website as well. But this was the first thing that we did to help guide that family through. And then again, over the past 5 years, we were always improving. And so just recently we implemented a new function for families. It's going to be rolling out, where there's a couple of different scenarios that we find families fall into. And it's, so are they just curious about a caregiving situation? They're just curious about the software and maybe looking to prepare. Are they in a active chronic situation? So there's no emergency right now. It's just something that we've got a caregiving situation. I'm needing to start documenting. Is there a crisis? So mom just broke a hip. She's being discharged from the hospital, and we're in crisis mode, which is often when a care manager gets called. Or is it end of life? And so end of life, they're not concerned about the flu shot next year. They're concerned about the important documents and things that they need. So a user can indicate which set they're in, and then we're going to automatically recommend tasks for them that prioritize what they should be doing. And that comes from our new best practices algorithm. So over the years, we found that there were all of these things that need to be done, and everybody was kind of reinventing the wheel. And so we've been gathering it over the past 5 years and built this algorithm where, based on the data that we have on the patient, we're automatically going to recommend best practices, such as if somebody's over 60, to get a shingles vaccination, if they're over 65, to get a pneumonia vaccine, if they haven't gotten a vaccine in 10 years, then they need the pneumonia booster. And these were things that I didn't even know existed. And now we can recommend, the family can stay on top of that. And we include the evidence associated with that. And also where there's medical cost savings, to kind of help drive the why they should be doing that.
Wow. And you know, the fact that you have aging life care managers, which we're going to dive into using this platform, and you've got this assessment tool, and the aging life care managers are embracing it and using it, really tells me that you've hit the right buttons on that assessment tool, because I know many of these aging life care practices have you know, their own sort of proprietary way of working with their clients and things of that nature. And so I imagine you've received a lot of feedback from that segment to get this dialed in, but the fact that the general public can use that assessment tool and a very active group of providers are using it tells me that it's probably pretty dialed in.
Yep, and that's for care managers. We found that everybody was doing something a little bit different, and so our professional functionality includes a lot of customization capabilities. But then,
Oh, good. So yeah, that was my question, because I can't imagine having something for an aging life care manager that didn't have the ability to customize it based on their practice.
yep. And I see actually an interesting question there. We talked about Hipaa compliance and stuff like that. So we built our software where top level security hosted on AWS and encrypted in transit and at rest and all of that fun stuff. And role-based security, so you can choose who gets access to what information. But then we get this question about, well, can a family member create a profile, and does HIPAA apply to a family member? And so HIPAA covers covered entities, and I should probably throw in a disclaimer. I'm not a lawyer. Talk to a lawyer. But HIPAA covers covered entities. So a family is not actually a covered entity. So once you share information with the family, if you have the permission to share it with the family, the family can then do whatever they want with that information. Theoretically, they could post it on Facebook, create a billboard, do whatever they want. And oftentimes you find families they've got a Google Doc or a Dropbox folder or something like that they have been storing this stuff in. And so CareTree actually creates a more secure solution for them that's better managed, so they can control who gets to see what. And even if the family, if a professional is using it for themselves, it's so good to have the family organize the information and have it in one place. And I've talked to emergency room doctors who are say I wish every family had this, instead of coming in with a binder full of records and a grocery bag full of medications and saying, here, if they just had the most pertinent information, then it would make their life easier. And if they have the right information, they can then provide better care. I talked to a doctor where he said, he's like, I know this one patient is seeing this other doctor, but I don't know what that doctor's prescribing. I don't know what that doctor is doing. So instead of me providing the best care possible, I have to provide the care that is least likely to negatively interact with anything he might be doing and potentially cause harm. And so that hurts patients by not having that information properly documented.
Great. Okay, let's see here. And then, okay, so we've got, okay, and just reiterate again, what is the cost to use?
So for families, it's free to use. And so a family member can create a profile. A family member could be invited by a professional, whatever it may be, that's completely free to use. For professionals, we have a professional version where there's additional functionality. So a company can then So care managers track case notes. Home care companies can do full scheduling in here. We integrate with QuickBooks and they can do all of their invoicing and all of the reports. So we have that additional professional functionality so companies can operate their business. Something that we have actually seen is we had a family on the West Coast where they had hired their own caregivers for mom, and they had 24/7 care for mom. They actually used the professional version so that they could use the scheduling feature, and they had the caregivers clocking in and clocking out, and they had everything organized in CareTree, and it was super easy, and they loved it.
You know, and that's one of the things, one of the reasons why I wanted to have you on is that as I've learned about your platform a little bit, we get in, I get a lot of phone calls, and I know a lot of the providers that are in our audience get them too, from what we refer to as do-it-yourselfers. You know, it's sort of like, look, I got to do this all myself. You know, no, I can't hire this. We got to do it. We got to keep it in the family, or I'm not going to hire a home care agency. I'm going to hire my next door neighbor, or what have you. And the challenge that we know is that the do-it-yourselfer, unless you're an organization management graduate level person, more than likely you're going to be learning on the job and you're going to make a lot of mistakes. And I think the fact that somebody can tap into a resource like this and potentially do the do-it-yourself on your own and be well managed there. And then the beauty, and the next question that I wanted to refer to here is that does this platform provide caregiver recommendations or recommendations to resources? Like, is that something that you have as an added component as part of this platform?
Yeah, actually, so that assessment that I showed you, that actually kicks out a recommendation list of resources and it may generally say, hey, reach out to home care. Now, if a home care company or a care manager uses, if they have our assessment on their website, then it actually connects them directly to their own company. And then with our algorithm, we're continuing to build into that. And so we know that resources continually change. There are new things that come out, and so we're going to be updating that, building in that resource directory so that depending on what their needs are, it's going to recommend the task, but also the resource that could help them with that task. So that's definitely something that we already have, and we're continuing to expand on.
Great. And let's see, Jim asks, what percentage of your users are living at home alone full time or at home alone for a period of time during the day or evening? Are you able to sort of pull together metrics on the users and things of that nature?
Yeah, we have aggregated data where we can run some of those. If that data has been entered by somebody, that's actually a standardized data field that we have, we can run it. Excuse me. I don't know that off the top of my head, what that statistic is though.
Okay, but we'll make sure to share your contact info, and y'all can follow up with Jim on that on that answer, or dive deeper to our audience. Let's see. Okay. Let's see. Have you done a review of the HIPAA regs and family and okay, you talked about HIPAA already.
Yep.
Okay. Okay, Judy has another good question. So can a caregiver enter on behalf of someone else? So or what I could sort of see is, what if, like, I'm just a concerned next door neighbor? What if somebody is a solo ager and I'm not legally a guardian or anything like that? Can I sort of utilize this platform?
Yep. So that goes back to that HIPAA question, where they could certainly create a profile, or I could choose to invite them in. And then the nice thing is what I can do is, I'll jump over to the activity feed. So I can choose who gets what permission. And so, for example, I could invite in that neighbor down the street and not give them medical permission. So then they don't see any of the medical information. They don't see the medications, the vitals, a note that's marked as medical. So we can use this for that group communication. And in our activity feed, this is going to show that running history of everything. But what I can also do is I can post an update. So with my grandma, when she was battling cancer, we had these different text message threads that were happening. And we'd forget to include my sister, who is the doctor, my cousin, who's a pharmacist, my other cousin, who's a nurse. And so there's all of this information getting relayed out to different parties. And they wanted them to have the medical information, but they didn't necessarily want to share that medical information with everybody else. And so with CareTree, you could have invited everybody in. The medical people get the medical information. And then instead of having different text message strings where I have to remember I'm putting it in the right string, I could post an update into here, and it will actually push out a text message or email to the entire care team. So everybody gets the update automatically. And then if I marked it as medical, then it would just restrict it to those people with medical permissions, for example. And instead of having this string of messages, they can comment. So you can have everybody knowing what's going on in one place. We also see this with caregivers. So caregivers may check in or do their work and update it, create an update directly into here. And so people know what happened today. Something else that's really nice on the caregiver side is the vitals. So with the vitals, we added this again because of a family issue. So the family friend was in the nursing home and the skilled nursing facility, and my mom was visiting him every week, and she visited and noticed that his weight looked completely off, and asked the nurse about it. The nurse looked at the chart, and they took a weight reading every single day, but nobody actually looked at the weight readings to see if there was some type of trend line. It was just go in, take his weight. And sure enough, he was off by 20 pounds in 1 week. And so they called the doctor, adjusted his diuretics. But that's where we added in the vitals, we made it the ability to graph and also set that alert threshold. So if that deviation had happened, it would have automatically alerted them and let them know about that. And then we also integrated with Apple Health and Google Fit. So readings could just automatically come into here.
I was going to say, do you have some integrations? One of the things that we've had on our discussions are things like the Oura Ring, and but one of our recent discussions, the amount of data that can now be collected with an Apple Watch device, which has no age stigma attached to it at all, is pretty exciting. So that's great. And one thing that I know is that a lot of these devices, they recognize that they're like Oura Ring, for example, the amount of data that product generates is overwhelming, and they recognize that they need to be integrated with platforms like these, where somebody is managing that data and looking at a variety of metrics and benchmarks and things of that nature. Okay, let's see. Zelma says, thank you for your vision and hard work developing this. So what are the main differences between the family version and the professional version? We can definitely jump back to the family version, but I think given the time that we've got, let's sort of talk about what it's like for a care manager or a home care agency or a provider out there that might want to utilize this technology. And obviously, because it's free, and any of the providers in our network can simply sort of say to their client base, this might be something that you find helpful to manage. Go to the website and set something up, but help us with the bells and whistles if they engage with you in a more formal platform.
Yep. So I logged into the professional version here, and along those lines, if they do want to use it in that level, we can also do a branded version, so they can have that branded experience associated with the company. But the big difference in the professional, so you can see it generally looks the same. We've got a dashboard. So if I'm managing a company, I can be managing my company metrics. As I mentioned, we've got some scheduling functionality. So there's a clock in, clock out for shifts. But then I've got dashboard metrics to see how my company's doing. A timer, so you can track it, time doing research if you're doing billing or a phone call, a visit. We have our company section, which has reports, employee management, data imports, company documents, things of that nature. And then on a patient profile, there are some company specific data fields. So capturing your referral sources and things like that. We actually have prospect functionality. So if you get a client inquiry, you can create them as a prospect, and then if they and track that and then convert them. For our care managers, they have the case notes. So you can document all of your case notes. We even do cool things like you can do voice to text to dictate in a case note, or forward correspondence you might have, email correspondence you might have with a family in, and it creates a case note automatically. And then, as I mentioned, all of that company functionality, so a centralized company calendar with all of the employees and clients, company contact directory, reports, the ability to add custom fields, import data, all of that. And so these features that you would use to manage and run a company, that's on the paid professional version. But again, we do see some families that upgrade to that professional version so they can have scheduling and manage that scheduling for mom or dad, and they find it extremely easy to use and helpful for that.
Great. Okay, so then back to that, Irene does have a question going back to the family version, is that does the family version permit keeping track of caregivers and appointments on a calendar? And I think I did see you had a calendar in one of your screenshots there, but it would be great to demo that, because I think especially if we're the do-it-yourself caregiver, you've got, family members and volunteers and paid professionals, and you've got this sort of menagerie of this cobbled together network, and having a calendar that can manage that enables that do-it-yourself family to operate more like a home care agency or a provider. So tell us a little bit about how this calendar can work.
Yep. So we have that calendar. This calendar I'm looking at has the shifts. So it also has the shift where I can create a shift for a caregiver to clock in or clock out. That's a professional feature. Otherwise, the family feature, the free version, has the calendar and you can add events. So that may be the doctor's appointment next Thursday. You can make a note that home care is coming in Monday, Wednesday, and Friday. Family that's coming in to visit, tasks of fill a med box, for example. So you can put all of that in one place so that everybody is staying on the same page of what's going on. When you create a calendar event, you can invite or assign other people to that event. And so then it will show up on their calendar in CareTree, and it would also send them a calendar invite. So I operate CareTree, but I don't necessarily, my life operates off of my Google Calendar. And so I would put a CareTree event in here, but then it automatically sends out that invite. So then it shows up on my Google Calendar, which is what I'm using for all of my calendaring. So it really makes it easy, and that can work for your Google Calendar, your Outlook calendar, whatever you may have there.
Great, I love it. So hopefully, Irene, that helps answer your question. Let's see. Stephanie says, and I hate bringing up other companies when we have these discussions, but as many people know, there's other alternatives that are out there, but she references that sounds like this can provide quite a bit of functionality and can also serve as caring bridge alternatives, so families aren't having to manage this and that. And I think probably many of us, at least I guess I'm familiar with Caring Bridge for more temporary sort of where somebody's in the hospital after an accident, and I get a link to a Caring Bridge communication that sort of helps us get through this next couple of weeks that person is in the hospital. Can you reflect on some of the other platforms that may be out there that people are familiar with, and how CareTree could be utilized similar or differently than those?
Yep. So Caring Bridge, lots of helping hands. They were both out when we started, but they were handling just that non-medical component. And so Caring Bridge, oftentimes it's with a medical issue, cancer, or some type of diagnosis, and you're creating this wall to update everybody. But then that family still has to manage all of that medical information. And it'd be like carrying around two different cell phones, because you want to use the one for phone calls, but then you've got the calendar and all of your apps on the other one. It's like, well, I can do that, but it'd be a lot nicer if I just had everything in one place. And when a family's stressed and managing all of that, you want it to be easier. And so that's what we did, was like that activity feed essentially has that Caring Bridge in for that functionality, where you can post an update, everybody gets updated. But then I have the choice of posting not only just kind of that general update, but also kind of detailed medical information, and restricting it to the people that I just want to see that, and then storing all of that information. So I, as a family member, don't have to go to different places to manage different things. I have everything I might need in one place.
Well, this is a good thing for our folks to know about, because one thing that I've said many times is that our people enter our system of elder care. Oftentimes it's a fall, and then you're in the hospital, and then what's going to happen next is somewhat unknown. So for those folks that are maybe familiar with like a Caring Bridge, when you've had somebody, and there's another one out there, when somebody's in the hospital, it's sort of like, maybe give CareTree a try, because the thing that I like about this is, let's say that the transition from the hospital is now that you're in home care, or you're getting assisted living or something like that. You've got this platform that can, or you're going to hire a care manager. You've got this platform that can sort of travel with you there. Okay, so let's see. Let's take a look here. Judy says, I like the vitals. Do you get to pick which vitals you use? For example, my mom, we were always monitoring bowel movements. I know, too much information. Can this handle that? Also, I like the scheduling. I was a driver with my mom, and scheduling is a real battle. Yeah, great real life examples there, Judy. Yeah, how could we monitor the almighty bowels on this platform?
Yep. So I was hoping you would touch on her question. It was funny, when my mom was watching out for our one neighbor, when we had checked in, she was always telling us, yep, she went to the bathroom today. Like that was always like one of the things she was letting us know, and I was like, okay, thanks, mom. We completely understand that the ins and outs are an important thing. And so that's in the vitals. You can actually, so we cover the basic ones that everybody's collecting, or the standard ones. Blood pressure, things of that nature, height, or heart rate, pulse. But then you can add your own custom categories. I've got bowel movements in here. You could track wound size, nutritional intake, a depression scale score, INR. So everybody's going to be a little bit different, and depending on their disease or their caregiving state, you're going to be needing to track different things. And so, yep, we added that ability so you can add in those custom categories, and track whatever you want.
That's great. And then Zelma says, so what would be the cost for a family to upgrade from the family? Okay, so do you ever have like a family that might be, actually, can you talk a little bit about the pricing of the professional version?
Yep. So the pricing starts out at, for the professional version, starts out at $10 per active patient per month, with
Okay.
a 3-patient minimum. It's $30 is the monthly price, and that covers 3 patients. And then if they need to create more or add more, it goes up from there. And then as your company grows, the price per patient goes down. So it keeps on going down, where it's then only a couple dollars per patient. And so for the professional side, we find that it's affordable for anyone from the company that is just starting out and they're hanging out the shingle to start their care management or elder advisory business, all the way up to, we've got multi-location franchise system, like giant companies that use the software as well.
Okay, great. And let's see here. Okay. Carol says, still concerned about security of medical and financial info on the internet when using this platform. What precautions are built in to assure users are actually those that we trust?
Yep. So when I invite in a user, I'll actually show it from the family side. So I invite in a user. I put in the email address. So email@gmail.com. I select which patient. And then I select which permission. And if I don't have the appropriate permissions, then I can't give somebody the permissions that I don't have. So it really limits on, I have to intentionally invite somebody in to access it. It's just not generally kind of publicly available, which is, again, a nice thing compared to something like some of those other companies. And then on the security side, that data is encrypted. So it's encrypted on our servers. The nice thing about a company like us is a lot of it's access controlled in terms of who can actually access what, versus when you have a large hospital system, you have to have thousands and thousands of employees be able to access all of this information, which creates the opportunity for openings and leakage. For us, we have a very limited core team that has access to this, so it eliminates all of those risk profiles and social engineering issues. So we take security very seriously, because I mean, I'm going to be putting my own social security number on there and my own medical information, so I want to make sure it's protected as well.
Great. Okay, let's see. And okay. Okay, Michael says, what B2B orgs do you think are most turnkey ready to use your offering? Communities, home care, value-based organizations? I guess the one area that I know that you're a proven resource is the aging life care practices, but I can see an easy application of this for home care, and even, you could see where this could be very easily implemented in a senior living community. Do you have experience with any of these segments, or do you have some verticals that seem to really work well with your platform on the professional end?
Yep. So aging life care, we estimate about a third of the aging life care professionals or private pay care managers use our software nationwide to run their businesses. So that's we do that. I think we're the best care management software out there, hands down. And generally, anybody doing private pay caregiving, our software can help with. We do have the scheduling functionality for home care companies. We have had senior living operators use us as well. So the primary thing is going to be kind of that care management. That may include patient advocates, health advocates, guardians, care managers, scheduling.
And one thing that I would say to the home care providers that may be in our audience, I know we usually get a handful, is that if you have a referral relationship with an aging life care manager, it might be worthwhile to sort of ask them if they're using CareTree, and or if they're not, maybe reach out to these folks and do a demo together, because I could see where what can be very exciting is where you've got a home care provider that's utilizing this, and you've got an aging life care practice that's utilizing this. Now you got two organizations that are really familiar with this platform. They're using it together with their shared clients, individually with their individual clients, and you can see where that type of synergy could work very well together.
Yep, and we designed it for that sharing where you can invite in multiple companies. That was something that we discovered recently, was elder law attorneys absolutely love our software and love the ability for a care manager to invite them in, because then, I mean, a lot of these elder law attorneys, they didn't have their own client portal. So now all of these documents that they're drafting, the family has a place to store. And then if they're working with a care manager, and then maybe somebody else is the guardian, that elder law attorney can log in, see what's happening in real time, and make appropriate medical or life decisions as needed. And that's where, generally, in terms of an audience for us, outside of that private pay kind of caregiving situation, CareTree is applicable to anybody that is looking to engage the people that are helping in a caregiving situation. So that can apply to hospitals, pharma, insurance payers. And we'd love to work with more and more of those long-term care insurance, because if you empower the families and those people that are doing that day-to-day boots on the ground caregiving, you're gonna end up with better outcomes, and everybody wins.
Mm-hmm. I love it. And I tell you, I just glanced at the clock. I was like, holy cow, I can't believe that we burned through an hour. But once again, our audience never fails with some really thought-provoking questions. Sienna, make sure that you drop your contact info into chat, but I'll make sure that I'll add that to the recording link that we'll post later today. Let's see. I want to wrap things up here, so be thinking about any sort of final statements that you have. But Irene says, if I'm an ER doc or nurse, how will they be able to access the CareTree platform? Oh, that's a really good one.
Yep. So a couple of different ways. So I can pull up so oftentimes what happens is if a patient is going in, or a client or a senior is going into the emergency room, they're going in with a family member. and that family member can simply pull it up on their phone and they hand it over to the doctor, and the doctor just scrolls through. We've got everything centralized into a care plan, and this is a face sheet that I designed with doctors on what is the information they need if somebody comes in. So it's organized for that. Our professionals can then customize it however they want. But you can do that. You could have this printed out and have it on the refrigerator, or we do have that emergency access function, like I mentioned. So if that link was on a medical alert bracelet or something like that, then they'd be able to use the emergency access function and gain real-time access to the information. And then that would automatically alert the care team that that there's an issue. And I see Sienna put our contact information in. If we're happy to reach out, you can visit our website. We've got our phone number, and then you can also schedule time with us if you want to do a further demo. Whether you're a family or a professional, we want to help you.
I love it. All right. Well, I really appreciate you both coming on, and whoops, sorry about that.
No problem.
Let's see, I'm gonna, oh gosh, here, I'm gonna stop sharing there. I appreciate you both coming on, and really excited to share your resource with our community. Keep us posted if you do any updates or anything of that nature. And thank you to the audience for some great questions and really moving this discussion along.
Yep. Thanks for having us, Steve.
You bet. Talk to you soon.